There's so much stigma around HIV and PrEP, especially here in the South. My name is Drew Armstrong. I'm a clinical pharmacist at Regional One Health in Memphis, Tennessee, and I run our PrEP clinic here. A PrEP clinic is where patients can come in who are at high risk of HIV infection, and they can get medications that can help prevent getting HIV. So the medications used in PrEP are actually medications we use to treat HIV. It's not the exact same medication. There's fewer medications for PrEP. And so patients can take the medications either every day if it's a pill, or they can get injection every other month. And that can prevent HIV infection. The PrEP clinic at Regional One has been active for a little over a year and a half. So I actually used to work in the HIV clinic here at Regional One, so I've always had an interest in ID and HIV. And then knowing that we did have a PrEP clinic here at Regional One, I knew we had a large population of at-risk patients, especially in Memphis, and so I really thought it was an area that we had a lack in terms of care here at Regional One. We have referrals mostly from our internal medicine clinic here at Regional One. But the community in general has been really great with uptake of PrEP in the Memphis area. So there's several PrEP clinics in Memphis that are kind of growing. So in the PrEP clinic, we have patients that will come in on an appointment basis. We'll interview them, get labs as appropriate. So we test for HIV, we'll test for any sexually transmitted infections, and then let them know their status and then prescribe medications if we need to. For the injectable patients, we'll actually have them come into clinic, draw the labs, give them their injection while they're here, and then follow up with their HIV test once that comes back. So we'll have patients scheduled to see me in the clinic. So I operate under a collaborative practice agreement with our physicians. And so I actually see the patients myself initially, perform the interview, ask the questions, order the labs. My physician counterpart comes back, sees the patient, makes sure everything's going okay, and then we let them go. We have such an at-risk population here in Memphis, and PrEP is such an underutilized tool to prevent HIV, and so the fact that I'm able to help patients that are at risk of HIV not get HIV is a really rewarding experience. And I think what probably surprises patients the most is how easy it can be. There's so much stigma around HIV and PrEP, especially here in the South, and so patients come in and it's just like, oh, it's a pretty simple interview, I can get a medication, I take it every day, it's pretty well tolerated, and I cannot get HIV if I take it like I should. So it's just kind of like a weight lift off our shoulders, and they realize how easy it is to actually get on. So I graduated from UT College of Pharmacy in 2013. I always knew I had an interest in clinical pharmacy, so I knew I wanted to do the residency route and then get a clinical job. So I graduated and I did a PGY1 residency here at Regional One in ambulatory care. And then I did a PGY2 at Duke University in ambulatory care as well. And that's where I really got a lot of exposure to the HIV clinic over there. They have a large HIV clinic, lots of research, and there's a pharmacist in that clinic. So I got lots of clinical exposure there. And then while I was there, they actually called me from Regional One and said, hey, have you had any HIV experience? And I was like, funny enough, I've actually had lots of experience. So they had a job opening here in HIV, and so I was able to come back and work in the HIV clinic. And I worked there for about 5 years before transitioning over to some primary care stuff, PrEP, and some administration roles as well. Good time management is a really good skill to have. You have to have good patient care skills as well, so you have to know how to interact with your patient and kind of pivot in the interview if you notice things aren't going well, or if the patient seems like they're, especially in a PrEP clinic, if you notice they're being a little reluctant to answer questions, you can kind of give them that comfort, like, hey, this is a safe space, you can talk to me here, and so kind of knowing how to read your patient and how to get the information you need while also comforting them and making sure it's, a safe space for them. Some advice I would give would be, number one, do pharmacy school, go through all of that. While you're in pharmacy school, take any opportunities you can to get involved either with research or leadership, or get a mentor in an area that you're interested in, especially those kind of niche areas like HIV or PrEP or other specialty disease states. And then pursue a residency if you want to do clinical work in that area. So there may not be a residency in that specific area, but you can do a residency that has a lot of patient population in that area, and you can have some kind of specialized rotations during your residency. And then after that, again, just kind of seek out opportunities that may exist, that you can get a little more understanding of a disease state or involvement clinically with that, and kind of build those relationships with physicians and pharmacists and different people that work in the area. We are more.